Hi, I am Dr. Saqib Mansoor, and today I will discuss with you trigger finger, also called as digital tenovaginosis. This is a finger stuck in flexion. So let's discuss. Thickening of a fibrous digital sheath on palmar aspect of digit causes stenosis of the osteofibrous tunnel, the result of repetitive forceful use of the fingers. If tendon of the flexor digitorum profundus and flexor digitorum superficialis enlarge proximal to the tunnel, the person cannot extend the finger. On passive extension of the finger, a snap is audible. Flexion causes another snap as thickened tendon moves. This condition is known as digital tenovaginitis tenosens trigger finger or snapping finger. Here you could see this. This is a pulley, A1 pulley, annular pulley 1 at the metacarpophalangeal joint. This is the flexor tendon, and this is the tendon sheath. Tendon sheath gets attached to finger or thumb bones and keeps flexor tendon in place as it moves to flex the digit. A1 pulley is near the opening of the tendon sheath at metacarpophalangeal joint, as I told you already. So, underlying cause is not known, but the condition is definitely more common in patients having diabetes. Patients with rheumatoid disease can develop synovial thickening or intratendinous nodules that may also cause triggering. Though sometimes blamed, occupational factors are not likely to be causative agents. Any digit can be involved, but most commonly thumb, ring and middle fingers are affected. At times, many fingers at a time can get affected. Patient hears a click as the finger is flexed. When hand is unclenched, affected finger initially remains bent at the proximal interphalangeal joint, but when increased effort, it suddenly gets straightened with a snap. Here you could see this. This is the proximal interphalangeal joint, and it is flexed over here. So a tender nodule may be felt in front of the metacarpophalangeal joint, and click can be reproduced at this site, may be alternately flexing and extending finger. So infantile trigger thumb. Parents at times observe that their baby or infant is unable to extend the thumb tip. Diagnosis is usually missed or condition is mistakenly taken for a dislocation. Very occasionally, child grows up with thumb permanently bent. It is necessary to distinguish this condition from the rare congenitally clasped thumb, where both the interphalangeal joint and the metacarpophalangeal joint are flexed due to congenital insufficiency of extensor mechanism. So, what's the treatment? Rest and use of analgesics in adults. Early cases can be cured by an injection of the corticosteroid placed carefully at the mouth of the tendon sheath. This is the way to inject a steroid. Here you could see this. Splinting is the second one. Here you could see this. These are the splints. Recurrent triggering up to the period of 6 months later takes place in over 30% of the patients, especially younger patients and those with diabetes who can then need a second injection. And treatment in refractory cases requires surgery through an incision over distal palmar crease or in metacarpophalangeal crease of thumb. The A1 section of the fibrous sheath is incised until tendon moves freely. Here you could see this. This is the distal palmar crease, and the incision is given over here. You can see this is a surgical treatment of the trigger finger. Treatment in babies is worth waiting until child gets about 3 years old, as often there occurs spontaneous recovery. If spontaneous recovery does not take place, then the pulley is released. Care is to be taken to avoid injury to digital neurovascular bundles during surgery. Risk is maximum in the thumb, where nerves are close to the midline, and the index finger, where the radical digital nerve crosses tendon. In patients having rheumatoid arthritis, fibrous pulley must be preserved with care Damage to the structures which lead to the ulnar deviation of the fingers. Flexor synovectomy with excision of one slip of flexor digitorum superficialis is the preferred method. I thank you very much for listening and watching my video. And please do subscribe my channel.